Introduce our next speaker, Dr. Jason Cunningham, who I can tell you is an excellent family physician and really one of our key physician leaders in Sonoma County. Jason is the medical director of the West County Health Centers. He implemented recently, over the last couple of years, has implemented the electronic record system, which is no easy feat. And he has championed the creation of a patient portal in 2010 and really has redesigned this clinic as a patient-centered medical home. I can't say enough about the innovation and the attention to quality medical care that Jason has brought to this position and to RCHC. Jason?
Thank you. I've been given a mic again. And what I'd like to do today, I guess, is inspire. And there's something special that's going on here. There's something special that I'm a part of, that I'm standing on the shoulders of, that we are not just talking about this medical home, which is what I'm charged to talk about today. We're talking about standing on the foundation of over 30, sometimes 40 years of a lot of work that people have done towards being focused on the patient. And I'm proud of that. And I have to say that when I talk about who I am, I'm the medical director of West County Health Centers. I'm a family physician. I get this kind of light in my eye. You know when you're at an event and somebody says, "Where do you work?" and you kind of get excited about it. My wife kind of has to tell me to stop talking about it. There's something about being proud of something that you do that's very special. And it's not just being part of West County Health Centers, although I gotta say, working at West County Health Centers has been a dream. It's being part of something bigger. And working at a community health center level, working at a federally qualified health center is something very special. There's something about not having to look at the person that I'm treating and say, "What insurance do you have?" There's something about not being able to say, "You know what, I'd be happy to help you with your blood pressure, but please don't tell me about your life troubles, because I can't deal with that," right? There's something about when I look at somebody in the eye and they have a new diagnosis of breast cancer, I don't have to say, "You know what, I hope everything turns out right." I can say, somebody's going to walk beside you and help walk through that with you and help navigate that system. There's something special about that. And that doesn't happen everywhere. Those of you who are partners in healthcare recognize that that is something special in our community health centers to offer. And that's 30 years plus. That's special. And when we talk about this medical home, which community health centers have certainly drunk the medical home Kool-Aid, it's really something that we're able to say, you know what, we've done a lot of this. That 10 years, and honestly I can say that, you know, being part of leadership on a federal level, Herb Schultz will talk a little bit about kind of what plans and leadership they're planning on. We have, you know, over 10 years ago, most of us, when we're dealing with chronic illness right now, when we have really transformed our system in a major way towards trying to walk beside people and with diabetes or chronic illness, it's because we were given a mandate by the Bureau of Primary Health Care about 10, 15 years ago that said, you guys need to figure out how to walk beside people with chronic illness. And they gave us funding, and they put us all together in a room and said, collaboratively, let's figure it out. And it transformed us. It really transformed. It said, at a federal level, they didn't say, do this. They said, you guys, let's put people together and help figure this out, and it helped transform our what we do things together. There's something about being part of something that has leadership ahead of it that makes a big difference. There's something about being part of, you know, Redwood Community Health Coalition, that we're not doing this together. You know, we sit together with medical directors or clinicians, and commonly we say, okay, we're going to share selflessly and steal shamelessly. There's something about being able to move each other forward to say, what are you doing? I want to steal that document. What workflow do you have? If we're looking at an electronic health record, there's no way we would have done it without doing it together. There's something about that tradition that we're not talking about market share. We're not talking about competition. We're talking about how to figure out how to do this for patients. There's something about doing something as a patient-centered group. Many of you know that community health centers, as part of our organization structure, our board is made up of more than 50% patients. And that's not new. That's not a medical home transformation. That's community health center transformation. So I'm proud to be part of community health centers. I'm proud to be part of this organization. I'm proud to be part of leadership that goes along with this. But most of all, I'm proud of the people I work with. I'm inspired every day when my front office staff says, instead of, I'm sorry, I can't do that for you, they say, you know what, I see that's a problem, let me figure out how to help you do that. There's something about when I'm walking along somebody who has real issues, I can say, you know what, I'm going to bring somebody along next to you, my nurse or a nurse practitioner, that says, I'm going to walk through the muck with you. I'm going to figure this out together. Many of you can tell probably, or have you worked with me, I want to change the world. You know? I'm not ashamed to say that anymore. I heard that at a speaker. Somebody said, you know what, we should stop being ashamed that we want to change the world. But there's something more important about, instead of changing the world, helping somebody change their lives. There's something much more profound when you're looking beside somebody and saying, what do we need to do together? I'm going to walk with you to do that. And that is a vision that when I mean, we have 120 plus employees, almost every single one of them, I can say, that person, in fact, not almost, every single person in that agency has a mission driven. They want to do that together. So with all that being said, there's something about this medical home that is a transformation. We are now moving beyond even chronic illness. We're moving beyond taking care of the individual. There's something of a transformation that's happening. And to me, this is one of the most exciting times to be in primary care. If you were to say 5 years ago, you know, this is a new idea, and to see how the traction that it's had right now, that we're talking about this is at a federal level, that it's put into legislation, that we're talking about this as a community, there's something very special about that. So I'm going to spend a little bit of time articulating the concepts around the medical home, and I really urge you to spend some time looking this up. There's a lot of good stuff out there now that is being articulated. You know, 5 or 6 years ago when we were starting to rethink our own healthcare redelivery, the care design redelivery, it was still kind of in this beginning stages of articulating big principles. There's a lot out there now that you can look up, and I encourage you to look that up as you're starting to advocate for this system. But the concept really is our current system doesn't work. Profound, right? It just doesn't work. We do excellent care. People come from all over the world to get procedures. We do stuff to, you know, surgeries in utero, you know, on hearts, and, you know, some crazy stuff. If I had a heart attack, I am so glad that we have incredible procedures that we offer. The problem is we do a horrible job at a lot of the stuff that we need to do a much better job at. Chronic illness, prevention. We have a disease care system, right, rather than a health care system. We focus a lot more on when things happen to people, let's fix them, right? Well, we forget to talk about let's not have that happen in the first place. When you go to the hospital, we provide pretty good care. Why do we have to put people in the hospital to begin with? Because we haven't figured out how to do chronic illness. Michael McGinnis, in 2002, there was a Health Affairs article. Look that up if you're wanting to find something profound. It basically said, what are the things that determine, or what are the predeterminants of early death? What things really contribute to people dying early? Well, guess what? Access to health care, 10%, right? And I'm not saying we shouldn't advocate to have access for health care, right? But we do a lot less than we think we do, right? Or we profess that we do. 30% is genetics. You know, 10% is environmental factors. Behavior, 40%. What we do, who we're around, what we're addicted to, what we eat, how we exercise have much more profound influence on our outcomes than access to me as a primary care provider, right? So how in primary care, how in the health system can we start influencing behavior in a way that's profound? How can we start influencing our obesity epidemic? How can we start influencing children who are getting diabetes as teenagers? How do we start influencing what we eat? How do we start influencing how we exercise? Well, that's the medical home. And the reality is, this concept is that behaviors are less, we have influenced less by being told what to do than what we are influenced by attracting. So relationship is the primary principle of the medical home. That the key product in medicine, but primarily in primary care, the key product is relationship. That long, trusting relationship with one clinician or care team over time. That instead of the episodic care, you go to see a different doctor every time. You go to see the ER and you don't have follow-up. You don't have somebody that knows what happened to you 10 years ago. You don't have the same person being able to say, you know what, I get what you've walked through. Let's figure this out together. That is relationship, and that's what we're talking about in the medical home, that we need to have access to a team that gets to know people over time. And the second principle that really is important is that you have to have access to that relationship, right? If your access is 2 weeks out, or 2 months out to your primary care provider, that great relationship you have, guess where your access is? Guess where your relationship is? The ER physician, right? So that relationship has to have accessibility, and so one of the key tenets of the medical home is that you have access when you need it and the way that you need it. That you should have, if you need to be in the doctor's office, you should have that same day. Now, here's a profound statement. Do you really need to go to the doctor's office? Can we do it by email? Can we do it by video conferencing? Can we do it by group visits? Can we do it by case conferencing? Can we sit somebody, an elderly patient, their caregiver, their primary care provider, their specialist, and their community health worker all at the table at the same time? Wouldn't that be more profound than sitting at a 20-minute visit with your primary care provider? That's the kind of stuff we're talking about in the medical home, transforming what we're doing. And the third thing is really we can't do this. The concept that, and honestly, I got to tell you, this is kind of where I was going. I want to do it all, right? I want to get out there in the rural area and be the primary care doctor. Well, the reality is, it doesn't work, right? So I'd be running like, on a hamster wheel. That's what I'd be feeling like. In fact, sometimes we do feel like that still. And the reality is we need to be able to empower a highly functioning team to do that with us, right? So somebody who's sitting next to my patient is not just me saying, you know what, let's talk about weight loss. When we're talking about behavioral change, we need to be talking about coaching and empowering and patient advocacy with each other. That's the kind of stuff, and that happens through team. So we need to start restructuring who we are as a health delivery system towards a team. And the fourth thing that really is important is that we need to start thinking about patients and populations. So although I said we need to be able to help patients transform individually, we need to, as a system, start talking about populations. When I say, in fact, we had a health educator who came to our system who was doing some training for a medical assistant. It was inspiring to me. She said, you know what? I've never been to a clinic that does population care like you guys do. And I go all over the state. You guys have your medical assistants knowing every diabetic in your system, and you call them ahead of time to get stuff done. Before they get to the appointment, they have their hemoglobin A1C lab test that's needed. They have their eye appointments already made. Not because the primary care provider made it, because you've empowered your medical assistants to look through data and make a difference on that system. There's something special about taking care of populations. We're seeing our mammogram rates go up and our colonoscopy screening done and our immunization rates done, not because me as a provider remember that this person needs it. It's because we're having a system that allows us to take data, electronic health records. I gotta say, it was a bear to go through. We're on the other end of it, and we're using it. It's a tool now, right? We can say, who are my diabetic patients? Who are my patients that need extra help? And that makes a difference. So I'm gonna say there is inspiring things happening. It's not just, this is something that we're gonna do in the future. There is innovation happening at the ground level that is inspiring. So my challenge to you guys who are in the media, ask questions. Go to your community health center and ask them. Go to the executive director, the chief medical officer. Go to the front, even better. Go to the front office staff and say, what is inspiring to you and what are you doing in innovation? And write about it. Because there's crazy stuff happening. There's portal. People are being able to access now by email. People are being able to do virtual visits. People are being able to do group visits. Patients are empowering each other in groups. And there's behavioral health happening. There's complementary medicine. We're dealing with health education. There's all sorts of stuff that is happening in an innovative level on community health centers that's not happening elsewhere. Honestly, it's not happening elsewhere. So go to your community health center, figure out what they're doing, and write about it. If you're, honestly, I've walked a lot with a lot of you guys, right? So there's a lot of community partners here. Continue to meet together. Let's figure this out together. If you are wanting to get involved financially, go to your community health center and don't just please donate. But do more than that. Get excited about it. Go in there and say, what can I invest in this particular thing? What innovation can I really put my money behind? Go and write your, Camila is an incredible advocate for us, and she's a great speaker, but she's on the other end of things every day advocating for us. Figure out how you can be involved in that kind of stuff. So more than just community health centers. I'm incredibly proud to be part of community health centers. Community health centers are leading something very special in care delivery transformation towards the medical home. So thank you for letting me try to inspire today.
Thank you, Jason. That was inspirational.